Pharmacy Skills Lab Communication Assessment.
How can I help you?
I have a prescription to pick up for my daughter.
What's your daughter's name?
Lily Cooper.
Lily Cooper? Okay. Yeah, I have that here for Lily. When was Lily's date of birth?
February 2nd, 2018.
Okay, so she's just had a birthday not that long
She's
ago.
just a year old now.
So just turned. So before we get started, I just wanted to know, this is an antibiotic. It's for an infection, and it's a yellow banana liquid. And I was wondering, has Lily ever had this medication before?
No, Lily's never had any medications before.
So this is her first one?
Yes.
Well, the good news is the doctor gave her something that tastes good. So hopefully for her first medication, this will be a positive experience for her and won't not want her to take medications in the future. So hopefully it'll work for Lily as well. Now, before we get started, I just wanted to ask you a few questions about Lily and about her medical conditions, and I was wondering if you had a few minutes.
Sure.
Okay, so this medication, like I said, is an antibiotic, and it's used for infections. What type of infection does Lily have?
She has an ear infection.
An ear infection, okay. Is it quite painful?
Well, she's only one. She's been quite fussy. So but I've been giving her some Tylenol, so hopefully that's been helping.
Okay, yeah, that's a great idea, especially if she is fussing. But tell me more about this ear infection.
She's had it, I think, for a few days. She was really fussy and upset, and then I found that she was like really tugging on her ear a lot. And so I was giving her Tylenol because at first I thought she was just teething, and then I brought her into the doctor's office, and she said that it was an ear infection, and she prescribed this. So
yeah, when they tug on the ear like that, that's a pretty and fussing and stuff like that. Are you nursing her right now at all?
No, I stopped nursing.
Okay, yeah, I was wondering because sometimes they have troubles nursing as well. Does she have any fever associated with that?
I don't know. I think they took her temperature in the office. They said it was 39.
39. Okay, yeah. So that's a pretty good fever for a little one like that. So I would continue giving that Tylenol that you have started, not only for the pain but also for her fever as well.
Okay.
So now that we've decided that this is an appropriate medication for Lily for her ear infection, I just want to get some information about Lily. I know this is her first medication that she's been on, but has there been any indications that she's allergic to any kind of medications or any kind of allergies?
No allergies, no.
No. And other than this ear infection, how about any kind of medical conditions?
No, nothing I can think
okay.
of, no.
Again, this was her first medication that you said, so am I to assume that she's never been on any other prescription medications?
No prescription medications, no.
How about any self-care non-prescription medications like the Tylenol that she's already on?
Nothing I can think of.
No? Okay, so just the Tylenol over that you buy off the shelf is all you've been giving?
Yeah, sometimes I give her vitamins.
Oh, vitamins, yeah. So, so vitamins, what kind of vitamins?
She's getting her omega-6. The 369 ones, the gummies,
yeah.
And then we give her vitamin D gummies sometimes too.
Vitamin D. Okay, so vitamin D, gummy, omega, and Tylenol. That's everything you've been giving her so far? That's
yeah, I think so, yeah.
Yeah, and that shouldn't be any problem to give that with this medication she's getting today, as well as I would continue to give the Tylenol to help with the fever if there's still fever as well as pain, and it's perfectly fine to give it at the same time you give the amoxicillin.
Okay.
So any herbal medications? That's one thing I did forget to ask.
No.
No? Okay, so I'm just going to take a few minutes here to show you how to give the medication. Did the doctor tell you how much you're giving or how to give the medication?
No.
No? Okay, so what we're going to do is, first of all, I would recommend storing this in the fridge because it tastes much better when it's refrigerated.
Okay.
And before you give it, you're going to give it a really good shake, and you're going to give 7 mils every 12 hours for a total of 10 days. So it's amoxicillin, it's an antibiotic to eradicate the ear infection, get rid of the bacteria that's causing that infection. So when you pull up 7 mils, we're just going to take it just like that, and we're going to make sure that the top of that black line reaches that 7 milliliter notch on there. Do you mind showing me how you would administer that 7 mils or draw that 7 mils?
So I just put it in the
Yeah, so you'll
container.
shake this really well.
Okay.
Then you'll put it in the container.
And then I'll just bring it up to 7 mils. Like that.
Excellent, excellent, yes. And I probably, because she's still so little and it's her first medication, I probably wouldn't put all 7 mils in her mouth at once. I would probably do it in about 2 or 3 installments. So after she swallows a little bit, let her swallow it, then do a little bit more until you get all 7 milliliters into her mouth. So you want to do that every 12 hours. So I would probably recommend maybe in the morning and then at bedtime, so there's roughly 12 hours apart between each of the 2 doses. With regards to this medication, it really starts kicking in pretty quickly. So hopefully Lily should start feeling better within about 2 or 3 days. But it's important that you still give the medication for the full course of the 10 days to make sure the infection clears up, okay? Even though she's feeling better. Side effect wise, it's usually pretty well tolerated. And like I said, it tastes really good too. So most kids really enjoy taking it. They look forward to it. But it sometimes can cause a little bit of some nauseousness, maybe a little bit of an upset stomach. So at that point, I would recommend to give it with something to eat if she seems fussing or complaining a bit of a tummy ache. The other thing is it can cause a little bit of diarrhea as well. So it's normal for the stools to loosen up a little bit, but if it becomes something that's hard to manage or becomes more severe or more lots during the day, then I would probably recommend you talk to the doctor, stop the medication, and phone the doctor, because we don't want her to get really bad diarrhea either. It's because it's her first time she's taking an antibiotic. Penicillin is one of the more common allergies that we see, but the chances of, is there any penicillin allergies in your family history at all?
Not that I know of.
No, yeah. So the chances of her being allergic are very slim, but just so you are aware of what to look for, if she develops a rash, usually it's a large area of the body, or she gets any kind of swelling in the face or difficulty breathing, those are all kind of signs of an allergic reaction. If it's just a rash, call your doctor, but if you noticed any kind of swelling or difficulty breathing, then I would definitely take her to the emergency right away. But don't let that scare you, because it's very not common, and usually the first reaction doesn't get to that full-blown anaphylactic reaction. So again, store it in the fridge, shake it up well. Do you have any questions regarding this medication?
I don't think so.
So I really think this is going to help Lily a lot, and like I said, she should start feeling better in a couple days, and make sure you give it for the full course of therapy. And we're here, so if you have any questions, our phone number is just on the label. Feel free to call us. My name's Donna if you want to talk to me personally, and I can help you through. And I wouldn't mind if I can phone you in about 2 or 3 days just to follow up and check with you to see how Lily's doing.
Sure. Okay. Thank you.
Okay, thank you.
The feedback provided in this video is comprehensive. In many situations, it may not be feasible or practical to provide such comprehensive feedback to a learner. Assessors should aim to provide the most comprehensive feedback possible with the time available, focusing on the most important aspects of what went well and what should be improved. Let's take a look at the feedback that would have been provided to this student. Here's what went well during the new prescription council. The interaction was organized, clear, and precise. This was achieved in part with the use of transitions to move the council along. For example, saying things like, "Now I'm going to tell you how to use this medication," sort of to set the stage for the information that was coming next. This is a nice technique to let the patient's mom know what we are moving on to and allow an opportunity to ask a question about what was just covered before moving on. The student expressed herself with confidence both verbally and non-verbally. She demonstrated this by maintaining an appropriate amount of eye contact, leaning into the mother, and demonstrating how to use the oral syringe for administering the dose. She had suitable language, pace, and tone for the context. She had appropriately used non-medical lingo in describing how the medication was going to work. The student's communication was clearly respectful, empathetic, and compassionate. The student demonstrated this by acknowledging that this was Lily's first prescription medication and ensuring her that the medication tasted good. She referred back to the fact that this was Lily's first prescription throughout the council, recognizing that this could be concerning for the mother, and provided reassurance. The student gathered information effectively through the use of open-ended and closed-ended questions, by using more open-ended questions at the start of the council by asking, "Tell me a little more about Lily's ear infection," and asking closed-ended questions to ensure that the medication would be safe for Lily. The student established an obvious rapport with the patient by recognizing that the mother may be concerned about her daughter and providing her reassurance. She also told the mother that she would follow up in 2 to 3 days to see how Lily was feeling. The student ensured patient understanding prior to departure. This was demonstrated when the student taught the mother how to use the oral syringe and encouraged the mother to demonstrate back to her how to use the syringe. Here's what could have gone better. The biggest thing here was the length of time this counsel took. In the lab, students are allowed a total of 7 minutes for their prescription counsel. The student in this case did run over the allowed time by around 1 minute. It is difficult to find an area of this medication counseling session that could have been left out to prevent this. In practice, this amount of time spent to counsel a mom on her child's first prescription medication may be reasonable. However, in the lab and in an OSCE situation, students must be mindful of the time they are allowed and meet the 7 minutes or less requirement. The student gathered information somewhat inefficiently and repetitively. You may have found that the student used a lot of verbiage in communicating the information. An area where she could focus on for improvement could be in being more concise in her explanations so that her message is clear and understood. Also, the student repeated herself a few times during the interaction. This could have helped in reducing her counseling time down to 7 minutes or less. Bottom line, the student demonstrated very strong communication skills. You may have felt that her communication skills were not perfect, but as a patient, I think you would walk away from that counsel thinking, wow, that pharmacist was really awesome, and I feel confident giving this medication to my child. And as a pharmacist, you would walk away from that counsel thinking, wow, that went really smoothly and that patient understood what I intended to communicate to them. This student would have achieved a communication grade of E had it not been for her going over time and for somewhat inefficient information gathering. As a result, she was given a grade of P, proficient.